Washington, D.C., 8 July 2025. Sweeping changes to Medicaid and the Supplemental Nutrition Assistance Program (SNAP) have been signed into law, but the most painful reductions will not hit until 1 January 2027 after the 2026 midterm elections, according to the final text of President Trump's Big Beautiful Bill. The legislation mandates work or community service requirements of at least 80 hours per month for most adults aged 19 to 64 who receive Medicaid, and it raises the SNAP work age threshold from 55 to 65. Analysts at the Congressional Budget Office warn up to 11.8 billion people could lose health coverage over the next decade as administrative hurdles mount. Over the 10-year budget window, federal funding for Medicaid will fall by about $863 billion, while nutrition support shrinks by $295 billion, shifting major costs onto states just as baby boomers age into higher care needs. State leaders are already bracing for impact. Connecticut projects a $13 billion loss in Medicaid dollars and hundreds of millions less for SNAP, a gap Governor Nate Lamont admits the state cannot fully replace. Republicans insist that delayed start proves the bill is fiscally responsible but politically fair, giving voters and agencies 18 months to adjust. Democrats say the timeline is pure election year optics. The harm is baked in, just deferred, argued Saint Ilhan Omar, calling the package the biggest transfer of wealth from the poor to the rich. Healthcare advocates add that 6-month eligibility checks, new premiums for low-income patients, and caps on provider taxes could force rural hospitals to close even before 2027. A $50 billion emergency fund was included to cushion that facilities, but critics level it a band-aid on an amputation. With state budgets due this fall and federal guidance expected by December, policymakers face a ticking clock. Watch for negotiations over waivers, exemptions, and potential court challenges in the months ahead.